Hello, Dr. Brad Holsabus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Hello, and welcome to another edition of Ask the Chiropractor. Now, for those of you listening, this should sound like a normal podcast. And those of you watching, you're going to notice the lighting is a little bit off, and it is a little bit off. I have a little mechanical problem with my lights today, so I'm improvising with a different light. So it looks a little darker than normal, but the message will be the same regardless of the lighting. So let's move forward. So today in Ask the Chiropractor was a fun topic for me because it just happened to me this morning. The other chiropractors that work with me, they're not in today. And so when they're not in, that means I see everybody. I saw their patients, my patients. Everyone that comes to the door gets to see me default though, because I'm the only one here. So I get to see all the patients today. And to me, that's fun because I get new people to talk to, people that don't know me yet. And presented with a challenge with one of the other doctor's patients. She hasn't been in like 3 or 4 months. She was just under active care. And I was very confused why she had stopped care. And she had told me that even though she had just started care, she was under active care for something going on, sciatica, I think it was. She was involved in auto accident. And she decided not to come in anymore because she was involved in auto accident. Now, she didn't seek care somewhere else. Like she wasn't going to a different chiropractor because she had an auto accident. She wasn't going to physical therapy. She didn't seek any kind of care after the auto accident. She just assumed that she should wait till her neck heals before she goes back to the chiropractor. And I told her, that's crazy, right? That of course you go to the chiropractor when your neck hurts, when you've been in accidents. I used the analogy, this tooth right here hurt for a while, so I stopped going to the dentist. I figured I'd wait to go back to the dentist until my tooth felt better. It's very illogical. If you're ever involved in a motor vehicle accident, work comp injury, some type of major trauma, of course you want to get checked by the chiropractor. And remember the name of this podcast, Ask the Chiropractor. Don't go to the emergency room, don't go to your family physician and say, hey, do you think the chiropractor might be a good stop? Because they just don't know. And they're going to tell you, no, you don't need to go because they don't know what it is. Most of the time, I'm not trying to throw your doctor under the bus, but majority of doctors, when they don't know something, they tell you not to do it because they don't know what it is, so it must not be good for you. But if you want to go to a chiropractor, ask a chiropractor. Don't ask your family doctor. If you're involved in a motor vehicle accident and you were a patient of mine that came in here, and you told me, I don't have any symptoms, I just want to let you know I was involved in an accident. I go, let's do a quick exam. Let's make sure that you weren't hurt. And what we'll do is we'll have you look up, look down, look left, look right, bend left, bend. We'll push on your head, we'll push on your shoulders. We'll do a couple tests to make sure there's no pain in there that maybe you're just not feeling yet. And a lot of times we'll take x-rays. Sometimes we'll just take normal x-rays of your spine. Other times we might take what they call a flexion extension series. We have you look up, look down. And when we do those ones, we can actually see what's moving and what's not moving based on the x-ray. So we'll take a pencil, we'll draw lines on them, and we'll see what's going on and what's not going on. And then we'll be able to actually tell you, yes, you have an injury, no, you don't have an injury. So if you have an injury, and let's say you don't feel it, then that's great. That means we found it before you found it. But if we do a test and we find out that there is something more going on, then we can go ahead and dive in deeper, take better care of you. So that's how we handle these things. So if you come into a patient here, we discover something, what we're going to do is we're going to do the flexion extension x-rays, maybe just normal x-rays so we can already see what's going on. Then we'll do a deeper dive into it. But we can't just say, okay, you don't feel nothing, maybe nothing's going on. Because we've had too often that people come in and then they come in next week, 10 days later, say, boy, my neck really hurts now. Initially, when an auto accident happens, your body goes into a spasm and they go into different things. And you might initially not feel it at that time. It might take time for it to kick in. So you can't go by how you feel because you might not feel it for a few days. And if the auto accident calls you and you tell the auto accident that, hey, everything's good, I'm not hurt, go ahead and close the case, now you're on your own. So always go ahead and get checked by the chiropractor right away because the chiropractor might find something way before you find it. So it's a great idea to always check with the chiropractor to see whether or not you actually have an injury. Don't go by how you feel and never ever go by what another doctor tells you, like you don't need to see a chiropractor, you'll be fine. Go see the chiropractor anyways, even if it's a physical therapist or a massage therapist or somebody else. Only as a chiropractor with an chiropractic care. That's the whole premise of this entire series of podcasts I've been doing the last 4 years just on that idea that only we're qualified to answer that. So anytime you're in a motor vehicle accident, get checked. Whiplash injuries, like I said, one that could come on later. A lot of times we x-ray new patients and we say, were you ever involved in a motor vehicle accident? And they're like, yeah, 10, 12 years ago. How did you know that? They didn't go to a chiropractor and heal from it. And they never felt it until we showed them the change on the x-ray, how the disc has changed, maybe the bones changed, maybe there's some spurring going on and some other things happening. That all happened because they were involved in an auto accident, which they didn't bother to get checked previously, and it came back to haunt them. So be very careful about that. Always make sure that you check with a chiropractor anytime you're involved in an auto accident. And majority of chiropractors deal with auto accidents. Not all chiropractors. You may find out that your chiropractor doesn't take care of auto accidents, and that's the decision the doctor in the clinic makes. If that's the case, have them refer you to another chiropractor that does take care of auto accidents. You can always go back to your previous chiropractor afterwards. We have patients here that we see that we refer to other chiropractors because they need more advanced care than in that certain area that maybe we're not specialties in, but other people are. Sometimes people need some upper cervical care because they've had a unique injury or unique listing in their neck, and so we'll refer them to an upper cervical chiropractor to get them over the hump and have you come back. Your family doctor doesn't take care of a torn rotator cuff. They refer you out to a specialist. The specialist takes care of your rotator cuff and sends you back to your doctor afterwards. So if your chiropractor doesn't want to take care of an auto accident, make sure you find out, ask them for one who does, ask them for a referral to a chiropractor that does take care of auto accidents. I feel it's very, whether or not your chiropractor will work with your auto insurance or work with your attorneys and stuff like that, that's up to the individual practice. My office, yes. We have a half dozen lawyers that we work with and a half dozen lawyers we don't work with. We work with the lawyers who work with us. We don't work with the lawyers who don't work with us. So if you come in, you have a certain attorney, then we'll take care of you. We'll have you take care of your bills, and the attorney, they can get you reimbursed. Other attorneys, we do it differently because other attorneys make sure that everything ends up good. So usually there are attorneys involved when you get an auto accident. The other very important thing, if you're in an auto accident and you're working with any type of doctor of any kind, be careful answering questions from the insurance company. Always ask them to ask your doctor when you'll be better. Ask your doctor when you'll be over things. A lot of times the insurance companies pretend like they actually care about you. They don't actually care about you. Sorry to break it to you. They only care about getting the auto accident closed and moved on. So always ask them to call your doctor and ask your doctor what's going on. Now, different states have different laws about how many different doctors you can see if you're involved in an auto accident. I know in Illinois, that's where I live, that's where I practice, you can go pick the doctors you want to go see. But I know like a work comp claim, because if I get hurt at work and I'm having a work comp claim, I have to go see my works doctor to verify I'm actually hurt. And I'm only able to pick one doctor of my choice. Now that one doctor can include a chiropractor, can refer you to as many doctors as they want to refer you to, but you have to go through the referral system. You can't just go to 5 different chiropractors or things like that. You need to go through a referral system. Now, auto accident's different, but it's very important. If you want to know more about that, how the chiropractic laws and stuff like that work in your state, call your chiropractic state association. If you live in Ohio, type in Google search Ohio Chiropractic Association, you'll find it, no problem. Illinois, you contact the Illinois Prairie State Chiropractic Association, and they can tell you the guidance and rules on that. Maybe even help find your chiropractor. So there you have it. If you're involved in an auto accident, stop at the chiropractor. It's very important. I normally let the chiropractor tell you whether or not you need care. Well, remember, if you have a question about chiropractic or chiropractic care, you can always email us, direct message us, leave wherever you're watching or listening to us, leave a comment there. And you can find the links to my website. If you go to my website and contact us, I get those emails. If you have a question about chiropractic or chiropractic care, I'll be more than happy to answer. Maybe next time you tune in, you'll be the question of the week. So you have it. If you're involved in an auto accident, make sure you check with your chiropractor if you need chiropractic care or not. Make sure you call the chiropractor if you're involved in an auto accident. It's very important. Other than that, stay healthy. If you have a question about chiropractic, always ask a chiropractor. Thanks, everyone.